Nobody plans to have their baby go to the NICU. You imagine holding your baby right after delivery, skin to skin, that first photo together. And then something happens. Baby comes early, or there's a complication, and suddenly your newborn is in a room full of machines and wires instead of in your arms. It's terrifying, and nobody prepares you for it. Today I'm walking you through exactly what the NICU is, what to expect, and how to get through it. Because knowledge makes this experience less scary. I promise. NICU stands for Neonatal Intensive Care Unit. It's a specialized hospital unit for newborns who need extra medical support after birth. About 10 to 15% of newborns spend time in the NICU. That's more common than most people realize. If your baby ended up there, you are not alone. Who goes to the NICU? Premature babies, born before 37 weeks. The earlier they're born, the longer they typically stay. Low birth weight babies, under 5 pounds 8 ounces. Babies with breathing problems. Babies with infections. Babies with heart problems. Babies with low blood sugar. Babies who need monitoring after a difficult delivery. Full-term babies can go to the NICU too. Sometimes babies who seem perfectly healthy at birth develop problems in the first few hours or days. Levels of NICU care. Not all NICUs are the same. There are actually different levels. Level 1, basic nursery care for stable babies with minor issues. Level 2, step down or intermediate care for babies who need some monitoring and support. Level 3, full intensive care for the sickest and most premature babies. Level 4, advanced care for the most complex cases, including surgical NICUs. Your baby will be in the level appropriate for their needs. Let me talk about what happens in those first overwhelming moments. When baby is taken to the NICU right after delivery, everything moves fast. A team of NICU nurses and neonatologists, doctors who specialize in newborns, take over. They assess baby's breathing, heart rate, temperature, blood sugar. They may put baby on a breathing machine or provide oxygen. They'll place an IV for fluids and medications. They monitor everything with equipment, heart rate monitor, oxygen sensor, temperature probe. And you're not there. This is one of the hardest parts. You just gave birth. You're recovering. You might still be in the delivery room. Your baby is somewhere else being cared for by strangers. The helplessness in that moment is overwhelming. I've been with mothers in that moment. I've held hands and said very little because there are no words. What I want you to know is, those strangers are the best thing for your baby right now. They know exactly what to do. Your baby is in good hands. Your first visit. As soon as you're stable after delivery, you'll be taken to see your baby. The first sight can be shocking. Your baby might be very small. Smaller than you imagined. There will be wires and tubes and monitors everywhere. There will be beeping. Constant beeping. The incubator, a clear plastic box that keeps baby warm, might be the first thing you see instead of your baby's face. It's overwhelming. It's okay to cry. It's okay to be scared. Take a breath. Look past the equipment. Your baby is in there. The equipment is scary because you don't know what it is. Let me explain the most common things you'll see. The incubator or warming table. Premature babies can't regulate their own temperature. They need external warmth. The incubator is a clear enclosed box that keeps a precise temperature. The warming table is an open bed with a heat lamp above it for babies who need easier access. This is not a sign of how sick baby is. It's just temperature regulation. The monitor. The screen showing lines and numbers. Heart rate, usually shown as a number and a waveform. Normal for newborns is 120 to 160 beats per minute. Oxygen saturation, shown as a percentage. They want to see 95% or above. Respiratory rate, how fast baby is breathing. Blood pressure, for more critical babies. The monitor beeps, a lot. Not every beep is an emergency. Monitors are very sensitive. Baby moving, a probe shifting, a wire coming loose, all cause beeps. Watch the nurses. If they don't run to the bedside, it's likely not critical. If they do run, they know what to do. Breathing support. Some babies need help breathing. There are different levels. Ventilator, a breathing tube in the throat. For babies who can't breathe on their own. CPAP, a mask or prongs in the nose that provides continuous air pressure. Baby is breathing but needs pressure to keep airways open. High-flow oxygen, oxygen delivered through small prongs in the nose. Regular oxygen through a hood or simple nasal prongs. Babies often progress from more to less breathing support as they get stronger. Seeing a breathing tube is terrifying. But many babies who were intubated go home completely healthy weeks later. IVs and tubes. 4 for fluids, medications, and nutrition. Feeding tube, a small tube through the nose or mouth into the stomach. Used when baby can't yet coordinate sucking and swallowing. Umbilical line IVs placed in the umbilical cord stump for very premature babies who need multiple medications. These look alarming. They're temporary. Here's something important I want you to hear. You are not a visitor in the NICU. You are your baby's parent. You are allowed to be there. You are encouraged to be involved. Kangaroo care. This is skin-to-skin contact where baby is placed on your bare chest. Even with wires and tubes, most NICU babies can do kangaroo care. The benefits are enormous, regulates baby's temperature and heart rate, improves breathing, promotes bonding, boosts your milk supply. Ask about kangaroo care early. Ask every day if needed. I had a patient whose 28-week premature baby was intubated and on multiple medications. She was afraid to touch him. He looked so fragile, but the nurses helped her hold him skin to skin on day 3. She said it was the first moment she felt like his mother, not just a visitor. Hands-on care. You can change diapers. You can take temperatures. As baby gets stronger, you can give baths, do oral care, participate in feedings. Ask the nurses to teach you. They want you involved. The more you're involved in care, the more confident you'll feel. The more confident you feel, the better it is for baby. Breastfeeding and pumping. If you're planning to breastfeed, start pumping as soon as possible after delivery, ideally within the first few hours. Your milk, especially the early colostrum, is incredibly valuable for NICU babies. Even tiny amounts of breast milk protect premature and sick babies from serious intestinal complications. Pump every 2 to 3 hours, even at night. Get a hospital-grade pump. Ask for a lactation consultant. If you're struggling to produce milk, that's okay. Ask for help. Don't give up without support. Donor milk is available at many NICUs if needed. Talking to your baby. Talk to your baby. Sing. Read. Even tiny premature babies respond to their parents' voices. Your voice is familiar. Baby has been hearing it for months. Research shows babies in the NICU who hear their parents' voices have better outcomes. Say their name. Tell them you love them. Tell them what you're going to do together when you go home. The NICU team can feel intimidating, but they're there for you too. Who you'll meet: neonatologist, the physician who specializes in newborn intensive care. They lead the team. NICU nurses. These nurses are specialists. They often care for only 1 to 2 babies at a time. Respiratory therapist manages breathing equipment. Lactation consultant helps with feeding. Social worker helps with emotional support, resources, logistics. Occupational therapist helps with feeding development and oral stimulation. Ask questions. You have the right to understand what's happening with your baby. Ask what each medication does. Ask what each piece of equipment is for. Ask what the goal is for today, this week. Ask what needs to happen before baby can go home. Ask about what you can do. Write questions down when you think of them. Your brain won't retain everything. Daily updates. Most NICUs have a daily rounds time when the team reviews each baby. Ask when rounds happen for your baby. Try to be there. You can ask questions directly and hear the plan for the day. If you can't be there in person, ask about calling in. Advocate. You know your baby better than anyone after a few days. If something seems different, baby seems less active, breathing looks different, color has changed, tell the nurse. You're not overreacting. You're parenting. Your observations matter. Let me be honest about the emotional side of the NICU. It's one of the hardest things a parent can go through. The roller coaster, NICU stays are not linear. Baby improves, then has a setback, then improves again. One day the nurse says baby is doing great. The next day there's a new concern. This roller coaster is exhausting and terrifying. Bad days feel catastrophic. Good days bring both relief and fear of the next bad day. This is normal. This is the NICU experience for most families. Guilt. Many NICU parents feel guilty, even when there's nothing they could have done differently. Did I do something to cause this? Why can't I just take care of my own baby? Why can't I produce more milk? I want to be clear. In the vast majority of cases, NICU admission is not caused by anything the parent did. Prematurity, genetic conditions, infections, complications of labor. These are not your fault. The guilt is a normal emotional response to an uncontrollable situation, but it's not the truth. Grief. You might grieve the birth experience you expected. You might grieve those first days that look nothing like you imagined. That grief is valid, even if your baby is going to be fine. You lost something, the normal newborn experience, and it's okay to mourn that. PTSD. Studies show that NICU parents have significant rates of PTSD, anxiety, and depression, especially mothers, especially parents of the most critically ill babies. Watch for symptoms, flashbacks, nightmares, hypervigilance, inability to stop thinking about it. Get help if you're struggling. Talk to the NICU social worker. Find a therapist. Connect with other NICU parents. You've been through something traumatic. You deserve support. Your relationship? NICU stress can strain relationships. Partners cope differently. One might be at the hospital constantly. The other might throw themselves into work. Neither response is wrong. There are different ways of coping. Communicate, even when it's hard, even when you're both exhausted. Check in with each other. How are you doing? Not just, how's baby? Taking care of yourself. I know it feels impossible to focus on yourself when your baby is in the hospital, but you need to eat, sleep, move your body, see daylight. A depleted parent can't show up fully for their baby. Eat hospital food, pack snacks, accept meals people offer. Sleep when you can, even short naps count. Go outside for 10 minutes. The NICU will call you if anything changes. You cannot pour from an empty cup. One of the cruelest parts of the NICU is going home without your baby. You're discharged from the hospital, you have to leave, and your baby stays. Going home without baby, this is devastating. There's no other word for it. You pack your bags. You walk past the nursery. You get in the car, and you drive home without the baby you came to the hospital for. Some parents can't bring themselves to go home at all. They sleep in waiting rooms. Others go home because they have other children or because they physically need to recover. Both choices are valid. If you go home, set up a system. Pumping schedule. Visit schedule. Who's on call with the NICU? Call the NICU anytime. Most NICUs welcome parent calls 24 hours a day. The in-between, the weeks or months of NICU stay are exhausting in a specific way. You're not pregnant anymore, but you're not really home with your baby either. You're in limbo. You might feel like you can't celebrate baby's arrival because they're still sick. You might feel distant from friends and family who don't understand. Find NICU parent support groups, online or in person. These communities understand. Preparing to bring baby home. As discharge approaches, the team will teach you baby's specific care needs. This might include how to use a monitor at home, how to give medications, feeding schedules, when to call the doctor. CPR training is often required before discharge. You'll feel terrified to take this tiny baby home. That's normal. Ask every question you have. Ask it twice if needed. The nurses want you to feel confident. They won't rush you. After NICU discharge, NICU babies often have follow-up appointments with specialists. Early intervention services are usually recommended: physical therapy, occupational therapy, speech therapy, depending on the baby's needs. These services make a significant difference in long-term outcomes. Don't decline them because your baby seems fine. Take all the support offered. If your baby is in the NICU right now, or if you've been through it, here's what I want you to know. Your baby knows you're there. Even the tiniest, sickest baby responds to their parents' presence. Your voice, your touch, your smell, it matters. It helps. Show up as much as you can. Your presence is medicine. The NICU team wants your baby to go home. Their entire goal is to get your baby healthy enough to leave. They are working toward the same outcome you want. Trust them. Ask them questions, but trust them. Most NICU babies do remarkably well. The outcomes for NICU babies have improved dramatically in recent decades. Babies born at 28 weeks who go to excellent NICUs often grow up to lead normal, healthy lives. There are no guarantees, but the odds are better than you might think. You will get through this. I know it doesn't feel like it right now, but NICU parents are some of the strongest people I know. You will find a strength you didn't know you had. And one day, whether it's weeks or months from now, you'll walk out of that hospital with your baby. That day will come. If you're going through a NICU experience right now, I see you. I'm thinking of you. It's hard, it's scary, and you're doing better than you think. Reach out to the NICU social worker. Connect with other NICU families. Accept every offer of help. And if you haven't been through this, but you know someone who has, reach out to them. Don't wait for them to ask. Drop a comment if you've had a NICU experience. Share your story. It might be exactly what another parent needs to hear today. Next video, I'm talking about something that doesn't get enough attention: postpartum anxiety. Because postpartum isn't just about depression. Anxiety is just as common and just as real. See you there, mama. You are stronger than you know.